In a bustling medical surgical ward, Nurse Maria begins her shift reviewing her assignment. At first glance, nothing seems out of the ordinary, a mix of post-op, medical, and chronic patients. Yet today, Maria applies a trauma-informed care (TIC) lens, subtly shifting how she approaches every patient and colleague. The first patient, Mr. Harlan, is scheduled for a dressing change on a major wound. Instead of simply explaining the technicalities, Maria sits at his eye level, quietly saying, "I'm going to tell you each step before I do anything. Is anything worrying you about this today?" Mr. Harlan's shoulders ease. He admits he feels anxious about not knowing what's coming next. Maria offers him the choice to watch or to look away. "You're in charge, I'll stop if you ask." Next, she checks on Sasha, a young adult admitted with uncontrolled diabetes. Sasha's chart notes a history of non-compliance. Instead of assuming resistance, Maria gently asks, "Can you tell me what makes it easier or harder to manage your diabetes at home? Is there something we could do differently today?" Sasha opens up about her family's distrust of healthcare due to past discrimination. Maria validates her feelings and offers to see if a caseworker can visit. Down the hall, Maria reviews the day's plan with her supervisor. Casually, the supervisor asks if anyone needs to debrief. The team has recently cared for a child after a traumatic accident. Maria appreciates this check-in. No one is expected to simply absorb or set aside their distress. A culture of psychological safety means she can express compassion fatigue without judgment. Everywhere Maria goes, she notices TIC in action. Another nurse, Eric, pauses before wound care, calmly explaining every step. He moves the treatment to a quieter room to respect the patient's need for privacy. The staff consciously use people-first, non-stigmatizing language in documentation. Ms. Lopez showed signs of fear when approached for a blood draw and responded well to step-by-step explanation. During bedside handover, Maria hears colleagues avoid labeling. "Mrs. Teo is not manipulative. She responds best to choices and calm interactions." They mention small strategies, like offering music, a hand to hold, or asking which arm to use for a blood pressure cuff, to maximize patient control and comfort. Beyond individual interactions, Maria notes that TIC is woven into hospital policy. There are flexible visiting hours, alternative de-escalation spaces, and an emphasis on minimizing restraint or seclusion. Staff are trained to recognize the effects of trauma on themselves and others. Supervisors model open reflection and offer brief moments to pause during intense shifts. Not every patient discloses trauma, and that is expected. Maria knows trauma is often invisible. By treating everyone as if trauma may be present, she helps eliminate the risk of re-traumatization. Every step, explaining before touching, asking permission, watching for distress, offering choices, serves to build trust and create safety. The effects ripple outward. Maria senses her own satisfaction rise as patients engage more openly, and fewer procedures are interrupted by anxiety. She feels less isolated when witnessing suffering, buoyed by a supportive team culture that values mutual trust and the ongoing processing of difficult experiences.